New progress on distribution of a coronavirus vaccine. The Trump administration announcing a new partnership this week with pharmacies across the United States to provide access to COVID-19 vaccines. The agreement covers 60% of chain and independent pharmacies across the U.S., including big names like CVS, Walmart, Rite Aid, and Walgreens. Joining me right now is U.S. Health and Human Services Secretary Alex Azar. Secretary, it's great to see you this morning. Thanks very much for being here.
Glad to be with you, Maria. Thanks for having me.
Before we get to the new program and the distribution deal that the administration has set with these pharmacies, assess where we are, Secretary. A lot of commentary about going into the colder months will mean a spike. We're seeing the biggest spikes that we have seen, certainly in the number of cases. How do you characterize things right now with regard to COVID?
Well, Maria, we're seeing cases increase right now, but we're seeing that happen in Europe. We're seeing it happen here. In fact, Europe on a per capita basis has got about 45% more cases per day than the United States has. Now, they're taking the same types of measures that we take, which is encouraging people to exercise good, responsible behavior. Wash your hands, watch your distance, wear face covering when you can't watch your distance, and stay out of indoor settings, especially where you're going to let your guard down, take your mask off, or get too close to other individuals. But this is because we're getting cold weather. People are moving indoors. That's happening, and it's really on all of us. But here's the important thing. Thanks to President Trump, this week we have delivered so many important milestones that are going to get us out of the coronavirus crisis, whether it's Pfizer's vaccine with 94% efficacy, positive data in historic time, or if it's approving Eli Lilly's monoclonal antibody for outpatients to keep them out of the hospital, or if it's Moderna hitting a critical milestone a couple days ago, days away from seeing their data, or as you mentioned yesterday, a critical new partnership with the business networks of our pharmacy chains. They're going to help distribute a vaccine, meeting patients where they are in their communities.
Yeah, congratulations to your team and really this incredible mobilization of the entire industry to get everything on the fast track. Obviously, so needed and so wonderful to be able to achieve that. Tell me more about this partnership. What does it involve? How will you ensure that the vaccine gets to those who need it in a timely amount period?
Yeah, so depending on which vaccine we're talking about, Pfizer will be doing its own direct distribution to pharmacies that we ask them to send to based on the instructions of our nation's governors under their distribution plan. So the vaccine will arrive at these pharmacies, white glove service, and the pharmacies will then execute distribution plans to the targeted populations that the governors have selected, we hope based on eventual CDC guidance for various groups. So we're talking in December, largely America's most vulnerable citizens. We'd have enough vaccine for them by the end of January, enough for all of America's senior citizens, our healthcare workers, and our first responders. And as we progress to the end of March to early April, enough for all Americans who want to get it. But 90% of Americans live within 5 miles of a pharmacy. And the pharmacists are some of the most trusted people in healthcare. It's where people like myself and my family get our vaccines, is through our pharmacists and our pharmacy chains. So we want to meet people where they are. This is typical of President Trump, using the private sector's expertise to get the job done.
And with this vaccine, it's a little tricky versus others because it needs to be refrigerated, right? Yesterday, we spoke with the CEO of BioNTech, Dr. Ugur Sahin, about the challenges involved in distribution because of the infrastructure it requires. Listen to what he had to say. How does that impact distribution of the vaccine, given that it needs to be refrigerated?
Pfizer has built up a distribution logistic allowing to transport the vaccine at minus 70 degrees to any place on the planet. We are collaborating and organizing a vaccine supply with governmental organizations to ensure that the vaccine could be supplied, for example, to hospitals. And then from hospital distributed to the vaccination centers.
Are there new challenges as a result of that distribution method, that it needs to be cold?
Yeah, Maria, the Pfizer vaccine does present unique challenges that we and the military and Pfizer and the distribution channel have all worked out with our governors. So the Pfizer vaccine does require extra cold storage. It also will come in large quantities. So it will be best attuned early on to mass vaccination programs, for instance, of healthcare workers at hospitals or our skilled nursing facilities, which was another key initiative we rolled out a week ago, which was with CVS and Walgreens, where they're going to be available to assist all of our skilled nursing, our nursing homes, and our assisted living facilities for mass vaccination programs, especially with the Pfizer vaccine, if the data and science support vaccinating those populations with the Pfizer vaccine.
You know, Secretary, we've spoken about this before. We are going to have to adapt and live with this, right? Because the vaccine will come on the market, which is great. You, the president, have said we'll get the vaccine by year end. You were right. Great that the president said it, and now it's actually materializing. But we're still afraid, given the spikes that we're seeing. Do you agree with some of the efforts being put into place across the country? In Chicago, the mayor saying, cancel your Thanksgiving plans. In New York, Governor Cuomo says, look, no more than 10 people at your home for any gatherings, and everything needs to shut down in New York by 10 p.m.?
Well, Maria, all of our measures have to be guided by evidence and science and not just assumptions. And what does the data tell us? The data tells us that our universities, our K through 12 schools have not proven to be major vectors of disease transmission. Our workplaces have not proven to be vectors of disease transmission. Our airlines have not proven to be vectors of disease transmission. Why is that? Because we have leadership at each of those types of institutions that are working with CDC guidance and putting in good controls in place to ensure people wash their hands, watch their distance, wear face coverings when they can't do so. We're seeing the spread occur in informal gatherings in indoor settings as we're now in the colder months. We're seeing the identical syndrome in Canada and in Western Europe. We are not unique in that regard. And that just means when we have our household gatherings, we've got to be extra vigilant, because those are settings where you're going to relax, you're going to maybe get too close with people who don't live with you, and you're going to take your face coverings off. And especially for Thanksgiving and Christmas, just advise people, please exercise extra caution, because you can get that disease from your family members and from neighbors.
Yeah, but I mean, people are worried that all of the lockdowns will come back, and
you don't need lockdowns, Maria.
Yeah,
I mean, the data,
exactly. That's what I was trying to understand.
That's what I'm saying. The data clearly demonstrate the interventions we need are simple. They're demonstrated, they're proven, but they're not forcing people to stay in their homes, shutting down our businesses, shutting our schools. You know, here's the amazing thing. In the United States, as soon as we see disease spread, so many local leaders and governors go immediately to shutting down our schools. You know what the Europeans do, and you know how cautious the Europeans are. The Europeans have placed a primacy on keeping their universities and their K through 12 schools open. They've done so even as they take other aggressive measures in their countries. We need to be having the same type of prioritization in our kids and our safe settings, keeping those open, and then taking interventions that all of us can do that are common sense, that will prevent the spread of disease in our personal lives.
All right, we will leave it there. Secretary, it's good to see you this morning, sir. Thanks very much.